Question 1. An unconscious person should not be dash. Placed in a position with the head lower than the body. B. Given an inhalation stimulant. C. Given something to drink. Answer is C. Given something to drink. Question 2. Which should not be a treatment for a person who has received a head injury and is groggy or unconscious? A. Given a stimulant. B. Elevate his head. C. Stop severe bleeding. Answer is A. Given a stimulant. Question 3. A person who gets battery acid in an eye should immediately wash the eye with A. Boric acid solution. B. Water. C. Baking soda solution. Answer is A. Boric acid solution. Question 4. A person who gets something in his or her eye and you see that it is not embedded, you can dash. Get them to rub their eye until the object is gone. Remove it with a match or toothpick. C. Remove it with a moist cotton tipped applicator. Answer is C. Remove it with a moist cotton tipped applicator. Question 5. A victim is coughing and wheezing from a partial obstruction of the airway. An observer should dash. A. Perform the Heimlich maneuver. B. Give back blows and something to drink. C. Allow the person to continue coughing and dislodge the obstruction on his own. Answer C. Allow the person to continue coughing and dislodge the obstruction on his own. Question 6. A shipmate chokes suddenly, cannot speak and starts to turn blue. You should A. Perform the Heimlich maneuver. B. Make the victim lie down with the feet elevated to get blood to the brain. C. Immediately administer CPR. Answer is A. Perform the Heimlich maneuver. Question 7. When starting CPR on a drowning victim, you should A. Start chest compressions before the victim is removed from the water. B. Drain water from the lungs before ventilating. C. Begin mouth-to-mouth ventilations as soon as possible. Answer is C. Begin mouth-to-mouth ventilations as soon as possible. Question 8. When administering artificial respiration to an adult, the breathing cycle should be repeated about dash 12 to 15 times per minute, 18 to 20 times per minute. C. As fast as possible. Answer is A. 12 to 15 times per minute. Question 9. If the person vomits during mouth-to-mouth resuscitation, the rescuer should first dash ignore it and continue mouth-to-mouth ventilation. B. Switch to mouth-to-nose ventilation. C. Turn the patient's body to the side, sweep out the mouth and resume mouth-to-mouth ventilation. Answer is C. Turn the patient's body to the side, sweep out the mouth and resume mouth-to-mouth resuscitation. Question 10. Bleeding from a vein is dash dark red and has a steady flow. B. Bright red and slow. C. Bright red and spurting. Answer is C. Bright red and spurting. Question 11. Blood flowing from a cut artery appears dash A. Dark red with a steady flow. B. Bright red with a steady flow. C. Bright red and in spurts. Answer C. Bright red and in spurts. Question 12. The major cause of shock in burn victims is the dash A. high level of pain. B. Emotional stress. C. Massive loss of fluid to the burned area. Answer is C. Massive loss of fluid to the burned area. Question 13. First, second and third degree burns are classified according to the dash. A. Area of the body burned. B. Source of heat causing the burn. C. Layers of skin affected. Answer is C. Layers of skin affected. Question 14. Symptoms of heat stroke are dash. A. Cold and moist skin, high body temperature. B. Cold and dry skin, low body temperature. C. Hot and moist skin, high body temperature. Answer is B. Cold and dry skin, low body temperature. Question 15. A crew member suffering from hypothermia should be given dash. A small dose of alcohol. B. A treatment for shock. C. A large meal. Answer is B. Treatment for shock. Question 16. Which procedure should not be done for a person who has fainted? A. Revive the person with smelling salts. B. Loose the clothing. C. Give pain reliever. Answer is C. Give pain reliever. Question 17. First aid means dash. A. Medical treatment of accident. B. Setting of broken bones. C. Emergency treatment at the scene of the injury. Answer is C. Emergency treatment at the scene of the injury. Question 18. While administering artificial respiration, it is most important to dash. A. Monitor blood pressure. B. Clear airways. C. Use the rhythmic pressure method. Answer is B. Clear airways. Question 19. A shipmate suffers a heart attack and stops breathing. You must dash. A. Immediately give a stimulant by force if necessary. B. Make the victim comfortable in a bunk. C. Immediately start CPR. Answer is C. Immediately start CPR. Question 20. The best way to prevent a critical incident stress situation from becoming worse is A. Ignore it. B. Be familiar with the signs and symptoms. C. Ensure early use of proper medicine. Answer is B. Be familiar with the signs and symptoms. Question 21. In cases of behavioral disorders, the responder should A. Always use restraint. B. Give the patient a choice in the treatment. C. Play along with auditory or visual hallucinations. Answer is play along with auditory or visual hallucinations. Question 22. You are taking blood pressure by palpitation. A radius pulse indicates a blood pressure of at least A. 110 mmHg, 100 mmHg, 90 mmHg. Answer is A. 110 mmHg. Question 23. The skeletal covering for the brain is provided by bones of the cranium. The overall skeletal structure covering the spinal cord is the vertebral column or spine. A. True. B. False. Answer is A. True. Question 24. You have tried to control a victim's forearm bleeding with direct pressure and elevation, but the bleeding does not stop. Where would you apply pressure? A. Outside the arm, midway between the shoulder and the elbow. B. On the inside of the elbow. C. Inside the arm between the shoulder and elbow. Answer is B. On the inside of the elbow. Question 25. What is the CPR procedure for a 6-year-old boy? A. 15:1, that is 5 cycles in 1 minute. B. 15:2, 4 cycles in 1 minute. C. 5:1, 12 cycles in 1 minute. Answer is A. 15:2, 4 cycles in 1 minute. Question 26. Shock is a condition where A. The respiratory system fails to deliver air to the lungs. The cardiovascular system fails to deliver to all parts of the body. C. All of the above. The answer is C. All of the above. Question 27. If an AED is available but does not have child's pad or child energy does setting, what should you do for a 6-year-old non-responsive victim? A. Perform CPR but do not use the AED. B. Use the AED but only apply one pad. C. Use the AED and adult pad. Answer A. Perform CPR but do not use the AED. Question 28. Irrigate eyes with A. Diluted vinegar. B. Saline solution. C. An appropriate chemical antidote. Answer is B. Saline solution. Question 29. In topographic anatomy, the term lateral means A. Away from the midline of the body. B. Nearer the head. C. Away from the head. Answer is A. Away from the midline of the body. Question 30. The onset of shock in infants and children. A. May be sudden and severe. B. Is no different than adults. C. Usually result from cardiac problems. Answer is C. Usually results from cardiac problems.